Hello everyone, my name is Najmul Islam and I am the narrator of this topic. Our topic is IVF. So let's just start with introduction of what is IVF. So IVF stands for In-Vitro Fertilization. In-Vitro Fertilization helps with fertilization, embryo development and implantation, so one can get pregnant. It is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. So what is the procedure of IVF? So during IVF, mature eggs are collected from ovaries and fertilized by a sperm in a lab. This fertilized egg is known as an embryo. The embryo can then be frozen for storage or transferred to a woman's uterus. One full cycle of IVF takes about 3 weeks. Sometimes these steps are split into different parts and the process can take longer. So we can say IVF is the most effective form of assisted reproductive technology. The procedure can be done using your own eggs and your partner's sperm, or IVF may involve eggs, sperms or embryos from a known or anonymous donor. Firstly, let's talk about the benefits of IVF. The best thing about IVF is that it can be used by anybody. IVF works where other infertility treatments fail. You have control over time and donated eggs or sperm can be used. It increases the chance of having a healthy baby and decreases the chance of miscarriage. Nevertheless, overcoming fertility difficulties is just one of the many IVF benefits that patients experience. It helps patients overcome a number of infertility problems, including male factor infertility, damage or blockage in the reproductive tract, ovulation disorders, and unexplained fertility. Secondly, about the disadvantages of IVF. Although this is one of the process of certain couples to have offspring, this procedure had many disadvantages and also side effects. Number 1. IVF cycle may be unsuccessful because the patient needs to face more than one procedure of treatment before it becomes successful. Secondly, this procedure is very expensive because this procedure is quite complicated and it needs to be done by specialist doctor using modern medical instruments. Lastly, during IVF cycle, multiple pregnancy might happen where there is more than one embryo put back into uterus. It is important for all fertility clinics to make sure only a single embryo will be put back into uterus to avoid multiple pregnancy. Thirdly, let's talk about the ethics of IVF. There are several issues on ethical values that must be considered in vitro fertilization. Number 1. The implications of pre-implementation genetic diagnosis. Number 2. The permissibility of sex selection or the choice of embryos for other traits. There are increasing trends to choose newborn based on criteria such as gender or the mother's IQ. This is in contrast to procreation, in which a baby is conceived as a gift between husband and wife. The kid conceived is the result of their love. The new person, not the object, represents the love of his parents. Furthermore, children are a gift from the God to their lovers. Number 3. The impact of losing access to donor history. When gametes are donated and the parents do not have access to the donor's history, the parents who is raising the child and the child themselves may lose knowledge of their family history. The lack of information does not affect everyone, but it does influence. Some people can benefit from understanding diseases that are more likely to be contracted or transmitted. Lastly, as the modern technology is under consistent development, these technologies have proven to elevate the quality of daily life from a general aspect. The IVF managed to impact the lives of thousands of people, which it was partaking in carrying relationships and strengthening the foundation of emotional bonds. Patients during IVF have witnessed better life quality and finding existing relationships more appealing to discover without the fear of potential risk caused by infertility sabotaging the future of it. The aspects of IVF are considered very rewarding, have been proven to influence patients' life choices including religious, physical, marital, financial, and emotional. At last, life post-IVF treatment can confirm major changes during this transitional point of a patient's life. coping mechanisms were deployed to retain sustainability in order in life, as most couples strive to be more cautious in decision making, self-growth, and have more tendency for relationships with others. Thank you very much. This is a short introduction of what is IVF and how this whole process works. I hope you liked our video and thank you for giving us a chance to present about IVF. Thank you very much.